Today we're picking up from last week's discussion around sexual dysfunction with Dr. Mark Opperman, who is back again in studio to give us more insight on the topic. Now, Mark, good to have you with us again. Let's continue because last week's discussion was very interesting. And perhaps let's start with a brief recap about what are some of the options that you use to treat sexual dysfunction in men.
So last week we mentioned that there's 6 options that my practice, for instance, would offer, and we touched on 5. So 2 of them being regenerative medicine, the platelet-rich plasma, or in my practice it's called the ED shot, electro-stimulation, peptide therapy, your prescription medications, and neurotoxins.
Right.
So the one that we didn't touch on last week, and the 6th one, and this is what completes the picture, is hormone replacement or hormone balancing.
So in terms of this holistic outlook, you've got the 3 elements. Talk to us about how testosterone fits in to those 3 elements of your physical, medicinal, and then hormonal.
So from a physical perspective, testosterone is responsible for muscle growth, etc., etc. Right. From a mental part, and this is where testosterone plays the biggest role, is higher function. In a sexual context, libido, yes. Which is sexual thoughts and fantasies. And from a medicinal point of view, testosterone increases blood flow, it increases bone mass, etc., etc. So, it bring all 3 together, and I restore the body to a more youthful state almost. So for me, it's almost like anti-aging medicine.
As with any form of holistic health outlook, it's very unreasonable to expect that you try and fix one thing and everything else will just fall into place. It's almost like you've got to look at all the moving parts together.
Absolutely. Again, testosterone is one of our steroid hormones, but steroid hormones is a whole group of hormones that all have their origin from cholesterol. So let's start there. If you have unhealthy cholesterol, you're not going to have healthy steroid hormones.
Right.
And those include, for men, testosterone, estrogen. For women, estrogen, testosterone.
Yes.
Your thyroid hormone, your adrenals, cortisol. Cortisol being a stress hormone. The higher your cortisol levels, the lower all the other stress hormones will be. It has a very negative impact. We have to look at insulin, which is the stress hormone, like cortisol. You have to look at your vitamins, vitamin D and iron, which plays a role in your thyroid metabolism, which then again has an impact on your testosterone and estrogen. So everything, the body is a very complex system of individual components, and if one of them break, the whole thing will collapse.
So when you're treating somebody for some kind of a sexual dysfunction, are you also giving them the lifestyle advice to support the work that you're doing?
Absolutely.
Have them do the work on their side as well?
Absolutely. When a patient walks into my office, usually by then we would have sent them the blood request form, so we have a blood tests. But then we go through, firstly, a medical history. Secondly, I go through what the patient is experiencing at that moment, what brought him into my office. And from that, we look at the physical shortcomings that the patient might have, and then we look at the biochemical markers, the blood results. And from that, I then take time, and this is the majority of my consultation time, to explain to the patient how all these things relate to each other and the certain conditions that they have, and how those different conditions play a role in how they're currently feeling. It's about the patient education. If your patient does not understand what is causing the problem, how can he fix it?
Right.
And you know what? That is where lifestyle becomes important, because your patient can only adjust his lifestyle choices if he has an understanding of what it's doing to him.
Indeed, yeah. So Mark, I want to take a step back in terms of men who come to you for consultations, I mean, it's difficult for a man to acknowledge, first of all, that there is a problem, and second of all, to then be open with somebody about it. So what do you see with guys who come in? Like, how do they react to the opportunity to consult with somebody who potentially can make a huge difference in their life? How do you manage that with them?
I think one of the things that we as men have to realize is we will all, at some point or another, experience some kind of sexual difficulty. It would be unwise not to consult help. I equated it this: if it happens the first time that an erection fails, you know what, you can accuse a lot of things for that. She's not pretty, I was tired, I was drunk, whatever. The second time it happens, it becomes a bit of an issue. And if it happens again, I've shot you through both knees, because now every sexual encounter becomes an encounter where I am anxious.
Right.
And that most probably is the nail in the coffin, that anxiety going into a situation. And this is where most of us then would reach out to over-the-counter products instead of consulting our GPs, who can help you with a once-a-day prescription medication, and that will take the edge off a little bit. Unfortunately, men with comorbidities, hypertension, diabetes, certain types of medications, certain types of injuries, have a problem that the over-the-counter or the prescription medications doesn't have the desired effect, or doesn't continue to have a desired effect.
Okay, okay.
And that's when, you know what, you should think about the regenerative therapies.
Right.
In my mind, you know what, the regenerative therapies, being that there's no side effects from chemicals, etc., everything comes from yourself. That would be step one. You know, instead of going to try and do prescription medications, which all have side effects.
Absolutely. Mark, I think it's really good that you've given a sense of hope, hopefully, to gentlemen out there who might be struggling with this. You know what,
we've seen so many patients that walk through our doors really, really at the end of their wits, with relationships that are about to be destroyed, etc., and we can fix that, and you can fix that, because all that we do comes from you as the patient itself.
Right.
So, you know what, there is hope. Unfortunately, it does cost a little bit of money. It's not freely available to all, but there are answers and there are solutions.
And it's so important to know that. So Mark, people who want to get hold of you to find out more, how can they do that?
Easy. Look for the T-Clinic website.
Okay.
It's the easiest. Or call us on Johannesburg 010-824-1393.
Wonderful. Well, thank you so much. Another great discussion, lots of good information. So thank you for sharing that with us.
Thanks, Michael.